Hello, I'm Sylvia Trujillo, and I'm the Executive Director of the California Telehealth Resource Center, and really delighted to have you join us on this journey. Today, we're going to have a really brief recap of the boot camp and why you and your team should consider joining us on this journey. Now is the time, and it's the opportunity to really join an incredible group of experts from around the country. So, what do we know? First, before we jump into what do we know, we're going to thank the U.S. Department of Health and Human Services for really making this possible. They fund many of the telehealth resource centers that are co-partnering to offer this event along with the Center of Excellence. And we really appreciate the investment that they've made in our organizations in order to provide technical assistance and education at no cost, unbiased to you all. This doesn't constitute an endorsement by them, but we really appreciate the funding that they've provided. So, why are you here today? Why should you care about healthcare AI? You have many resource challenges, you have staffing challenges, you have growing need, high patient acuity. Why would you allocate staff time and your time to this work? And the short answer is that we are going to see changes in the next 5 years that we have not seen in the last 50 years easily. We have a convergence of a technology supercycle. So not just artificial intelligence, but also we're seeing rapid innovation in bioengineering and the Internet of Things or sensors. And the convergence of these are really going to change the way that we think about medical care, the way that we deliver care, and really honestly how we embrace health. And so now is the time more than ever where you need to think about how am I going to give my staff the foundational skills? How am I as a leader, as either a clinician or operational lead, or the organizational leader, thinking about how do I give this information in a way that is going to be accessible, compelling, and powerful? And why should I invest the time? And the time is now because it is a situation where healthcare AI is not limited to clinical care. It's not limited to research. It's not limited to clinical decision support. There are many examples where it certainly is having an impact in all of those areas from research, where we're fundamentally redefining the way in which we undertake foundational research and implementation research. It's shortening timelines. It is changing the composition of teams, and it's also driving much more rapid cycles instead of 7 to 14 years from discovery to implementation. We are going to see a rapid shrinkage of those timeframes. We're also finding that AI is changing the way that we communicate with patients. These are agents. Sometimes bots that are regulated in any number of states. But we're also finding that these are ways in which we can meet patient need and demand and tailor the need and demand with very limited resources or frankly even shrinking resources. We also know that healthcare is document intensive from prior authorization to documenting really voluminous clinical diagnostic test results to the actual electronic health record and the information in there and creating meaning out of that. And so AI is rapidly changing the way in which we interact with our health IT systems and our expectations around usable information that we can implement very rapidly, whether it's as part of our operational work and our finances and optimizing our revenue, or whether it is taking us to a place where we're able to more effectively manage population health and we're integrated more fully into public health. So there's a lot of conversation that's going to happen, and you could see clinical care probably constitutes the biggest part of that circle oftentimes, but there's a lot of other applications of healthcare AI that are really changing what your front desk does, what your clinician does, what your health IT staff does, your population health and your community health workers, as well as your leadership. And so we really have something for everyone in the offerings that we are going to have over the next couple of months. So at the end of the day, what we really see is a partnership here with you where we're providing foundational education so that you understand what is AI, how does it work within not only my organization, but within my role, and how is it going to transform the work that I do. And it sets up a pathway for us to talk about things like leadership and strategy, governance, transparency, risk mitigation, patient safety, and many more topics in order for you to move to successful and responsible AI adoption. We have many states that are moving forward with regulatory frameworks around responsible AI use. We have an evolving federal framework and targets and priorities. And so we would like you to join us. We have lots of experience in the digital health space, thinking about things like telehealth and remote physiological monitoring and interprofessional consultations. And yes, even AI-enabled autonomous systems. So we are the folks you're going to want to come along with on the journey, and we are delighted to have you. And so with that, I want to lay out that we will be seeing you, we hope, on Wednesday, June 25th for a virtual session, another one on July 23rd, and then on August 12th, we're going to be offering a hybrid session. So our website, where you found us here, keep perusing. There will be more information and resources added as the weeks go by. And we'll be building a community for cohorts of you over the next several months after the boot camp concludes so that you can really become the leading ambassador in your organization for responsible adoption and innovation so that you can truly ensure that we have mitigated the peril of AI and we've optimized the promise. And with that, I thank you for your time and I appreciate that you've taken this opportunity to join us.